foot, I usually pull the stool just like I am when I'm teaching. It's a more comfortable position for me. With the tables at this height, it works pretty well. I'll often do this because it's pretty important that you get the right angles and the right contouring so it's a natural kind of position. So if I'm going to do, the first technique is called a 1-to-1. The second technique will be called a 1-to-5. Okay? So most interlongitudinal arch injuries, if it's an acute strain, the pain is going to be at the height of the interlongitudinal arch. If it's plantar fasciitis, the pain is going to be on the medial calcaneal tubercle, acute versus chronic. So the location of pain is a huge indicator. What is it when you extend the toes and push off and it increases the height of the arc? What's that called?
What, terminal stance?
You didn't read the book.
Yeah, I did.
Come on. There's even an X-ray picture of it.
Oh, yeah.
Generally, we call it the bowstring effect, but specifically it's called the...
Starts with an L.
No, starts with the W.
What's it called?
Has an L in it. The windlass sign.
Windlass.
Ah, remember that? Gosh, folks, that's important. You should have that picked up, and you should be there on that already. Okay, that's the depth of the reading I want you to be at. So with a 1-to-1, which is the first one, I'm going to put the foot in ankle neutral. Again, we talked about what ankle neutral is. Ankle neutral, stop here, is not talar neutral. Everybody with me on that? Talar neutral is this at the subtalar. Ankle neutral is just a slight degree of plantar flexion. Just a slight degree. So it's where the ankle, when you relax it, will land in a relaxed state. Some people flop way down, but it's generally right about there. Okay? Just a slight degree of plantar flexion. So I'm going to put my first anchor at the MTPJ. Again, I have clean shaven and sprayed. I'm going to take this directly to the skin after I've applied my tape adherent. My second anchor goes from the first MTPJ at the top of the foot, inferior to the medial malleolus, comes around inferior to the lateral malleolus, and tears at the fifth MTPJ. Your anchors are your landmarks. You don't go beyond your landmarks. No tape should go beyond your landmarks. So you have to establish where you're going with this. Now, I said I was doing a 1-to-1 first, right? Is that what I said? Okay. So 1-to-1. I'm going to start at 1. I'm going to finish at 1. The books actually show this the opposite direction that I want you to do it. And the patient can tell me why this works. The book will say you're going to go from 1, lock the heel, and come around to 1. That's a 1-to-1. I want you to start at 1 on the plantar aspect and come around to 1. Think that makes a lot of difference? Oh, you can even tell with that. Okay, that's I didn't really even expect you to be able to, but you can feel how that shortens the arch. It should take, and if you do this right, when I finish, I should be able to stick my fingers through that fan that I'm putting on the foot. So a 1-to-1 starts at 1 on the plantar aspect, finishes at 1 on the dorsal aspect. Then you go 5 to 5. Shift back half lapping, 1 to 1. What's next?
So do you not half lap when you come back over the dorsal side?
You need to end up at the same point. So
Okay.
you are kind of half lapping there, but it's ending
Okay.
at the same point there. Good question. So what's next?
5.
5. Okay. Half lapping, or even, I don't even know that I'd say half lap, I'd say spreading it.
Okay.
Because it's kind of hard to get a full half lap depending on your foot size.
Like you're
Is this like the same
fanning?
thing as like
This is a 1-to-1 longitudinal arch taping technique.
How
So
many?
you're fanning it out.
Okay.
I'm on my third there. And I'm on my third there.
what's the difference
3
between-
X's.
Isn't Lodi something that's
Lodi is completely different. We'll come to that in a bit. That's on your checklist, so give me a chance to get to everything on your checklist, okay? Actually, I'm going to bring that up because people call this a Lodi, and they don't know what they're talking about. A Lodi is a very specific technique using moleskin on the plantar aspect of the foot, and every physical therapist learns this technique in school, and they've called it the Lodi. It really isn't the Lodi, okay? So they're using incorrect
But you're still
nomenclature.
going 1-to-1 in the Lodi?
No, I'm going to talk. We'll talk about Lodi later. This is not the Lodi. This is the 1-to-1. 3 strips each way, so 1-to-1, 5 to 5. So you've got it fanned out through the sole of the foot. I like to take and go right straight down the center with my next one, right up to my anchor, and then a slight fan 2, 3. So I have an X at the center of the arch of the foot. So I got a 1-to-1, 5-to-5, 1-to-1, 5-to-5, 1-to-1, 5-to-5, 3 X strips. See that? So now I'm going to tie this baby together. I'm going to take and I'm going to go for my anchor and look at the direction I'm lifting. This is your question from earlier. You want to lift medially. I want to lift the inner aspect of the longitudinal arch. Half flap my tape. Again, I'm using my 1-inch tape. You'll see some people shift to 1.5 inches. I don't want to do that. I want this tight. And I don't get it tight unless I'm using a narrower tape with more strips. So I want you to do it with 1.5 inches. You guys in the high schools, you're not going to have the resources to do this. You're going to use the 1.5 inches and you're going to split it. And it works just about as well. And it's a lot cheaper. This roll of tape that I'm going to give you guys to practice with, this is about $1.85, $1.90 per roll, versus this roll of tape is 85 cents a roll. So it's a lot more expensive for a lot less product. Okay. So again, but it really works. You can see I even have a little wrinkling under here. See how that? That's okay because that's not going to be a problem.
Why won't that?
Because why? Answer that for me.
I have no. Well, are you putting it tight enough that it's not going to move around?
There's no friction, exactly right, because I'm taping directly to the skin.
Okay.
Now, if I had a big old fold like that,
Yeah.
that'd be a whole different story.
Okay.
But this is just because of the tension of the tape, so
Okay.
I actually don't like that a little bit there. But okay, again, I see how I've got her in partial plantar flexion. The toe is in just a slight degree of flexion, and I'm going from anchor to anchor. I'm pulling from lateral to medial. I'm giving really good, firm medial pull. I'll give you a handout. It'll be on Blackboard when I get it up and running. It shows this technique almost all the way through, just like this. And then it has a pair of scissors that this strip where it comes around here, you take and cut that.
What?
Why?
Wait,
Thank
where?
you. This, okay, so you're going to come here, and
Yeah.
it comes around, and you have the 3 layers right there. Cut it.
Oh.
But won't that like reduce all the
It makes it more
tension?
comfortable, but it nullifies the entire purpose of your technique. Your technique should shorten the length of the arch. I don't get it. I'm pointing this out that when you see this on this handout, it makes no sense to me, folks. I don't get it. I don't know why they would even do that other than patient comfort. Well, I'm looking for function. And they're pretty comfortable in this, by the way. My athletes that are in this, they feel pretty comfortable with this. So I've seen some that take it all the way up. You don't have an injury back here, so there's no reason to come all the way up around like you would with our basket weave that we did for calcaneal periostitis. And so from there, I've anchored there. I've half flap laced the entire thing, and I'm going to re-anchor again, covering up my loose ends, making it all nice and pretty. A lot of times, I will just loosely, just no tension, apply. Apply 1 to 2 strips over the top just to keep it all together. Okay, that's not necessary, and the reason I don't go all the way around is I do this to the foot, which that's uncomfortable, and they're going to cut it off. So it's just loosely tied to the top, just 1 to 2 strips. Now, what happens with that sometimes is that actually cuts the skin up here, so that's why this is just loose and doesn't go all the way around. And so again, that's not required. But when you're doing it on us as we're practicing, since we're not using tape adhere, that's a good way to hold it in place to see how it works and fits and feels. I also have seen people take and, what did I do with that Power Flex? I've seen people take and use 2-inch, not Power Flex, but a 2-inch light plast. It's got the adhesive on the back, but we'll simulate it with this. And they close it up with a couple circular loop. Hang on. Get it going in the right direction, Russ. See what I did?
Medial.
Got both circular lifts to give the medial lift on this, right? So I've seen people close it up with this with the elastic tape. 3 or 4 strips around, tear it on top. Okay? So nothing wrong with that either. The nice part of the elastic is it allows the foot to spread out, but it doesn't keep it from, it doesn't change its length, which we now have in a shortened state. So when she steps down on this, the tape has become the new arch. This works beautifully for interlongitudinal arch strains. It works incredibly well for plantar fasciitis. I also use this, and if it works really well and they have a chronic lower extremity inflammation that comes back year to year, and this works on them, that's a pretty good indicator that I'm going to go into orthotics for them. If it's chronic, it comes back, it doesn't go away, they're probably an overpronator, we probably need to solve it permanently. But if you have an acute shin splint, not really such a thing, but a kid, I mean, shin splints happen the first 2 weeks of the season, right? You're training, you're overworking, you're not used to the conditioning. This is a great way to take care of them during the initial part of the season, okay? So that is the one-to-one technique. You hear the foot? The 1 to 5